I decided that I just wanted something different. I wanted something less physical as well, probably for the first time in my life, um, so that I could still feel able to do the physical things outside of work. And also I wanted to find something where I felt more appreciated. I feel that morale is very low within the NHS, or certainly in the last trust that I worked in. Um, and that gets to you after a while. Initially, I was thinking about education, about working as a practice educator, uh, or I was looking for something that was um, predominantly office based, but it was very difficult to find an area where you could still be clinical, use your clinical skills, and not lose that, and remain clinical. So, I I had a look at IC24 a couple of times, and then I decided to go over to the contact centre itself, and have an informal meeting with one of the clinical trainers. And so, having done that, I was able to, have a walk around, meet some of the staff, sit in on a couple of the calls as well. And I thought, wow, this is really quite interesting. There was a lot more to it, so that sort of drew my attention. I do work predominantly from home now, and again, for I have my own reasons for that. Um, I can be around a little bit more for my mother. There's no uh, distance travel to work, so it's when you're finished your shift, you're at home. It's which helps a great deal with my situation. Um, I also have a working dog, so he needs quite a lot of attention during the for sort of about 4 hours a day of training and whatnot. So it really helps with that. Um, and yeah, so I work in the contact center one day a week now. Sometimes that's changeable when I have to take medical students, or when there's something else on, and the rest of the time is from home. So I do pretty much the same thing whether I'm at home or working in the office. I'm in the office on Mondays, which is quite a busy day for us. And yeah, so go in the office. Everyone's very friendly. There's a nice atmosphere at IC24, which is quite difficult to come by these days. Yeah, it's a big plus. They're very open to new ideas as well, uh, and very accommodating with people's lifestyles. They're very good with that. So that's helped me a great deal. With mine. Um, so we log on and we work from, as a clinician, we are responsible for calling the patients back. So when calls initially come through to a health advisor, you're taken through an initial assessment, and signposted to one service. That could be a GP, or it could be an emergency ambulance. The more complex calls that um, come through to clinicians such as myself, and we call patients back and go through the current issues. Now, a lot of the issues now also involve social issues, and of course we're seeing an incredible increase in the amount of mental health calls. Um, so our responsibilities are to signpost to the correct person. Now, that could be an emergency service, as I said, ambulance service. It could be directing the patient to a treatment centre. It could be a mental health crisis team. We unfortunately get a lot of suicide calls as well. So that could be comforting the person on the phone until an ambulance arrives. And also the social calls. So it's directing to social services. We do quite a few safeguarding referrals for elderly or people that are not able to cope at home. So there's a huge, huge spectrum really, that we are dealing with on a daily basis. So, a lot of people sort of under the impression that people just phone with a sore throat and are directed back to the GP for antibiotics. And I think I think that's the way that 111 was set up years ago, speaking to my colleagues that have been there for a lot longer. But of course, now the complexity of the calls are, yeah, yeah, it's quite different these days. So you're responsible for getting the patient the right help, the most appropriate help at that particular time. I enjoy having that one-to-one time with a patient, which is it's uninterrupted time with that patient, which it's not that way when you're, working in a busy acute hospital. Um, so that does enable you to focus and sort of unpick the problem, if you like, and yeah, pick out any areas that have I'm not saying meant necessarily have been missed in the past, but yeah, that you are able to have quite a lengthy conversation with the patient, to sort of get to the root cause. And I think that's very important, because quite often, we pick up on problems on the surface, and a lot of things get missed, and they sort of bounce backwards and forwards to places all the time, without dealing with the cause. So I do think that one-to-one consultation enables us to, not always, but a lot of the time, pick up on those issues. So I really like that about the job, that I really feel that I'm helping the patient, and most of the time the patient's so appreciative that there is somebody there on the phone, listening to them, understanding their problem, and trying to help them. Um, and that's a nice thing, that you actually feel like you're making a difference in that person's life. Yeah, with the IC24, I think the biggest difference that I've seen is they they listen to you as an individual. They take on a person's employer's personal situation, outside of work as well as in. I mean, it's not been too much trouble, and I've seen this from other colleagues around in the office, that it's not too much trouble if you require a certain seat, or height from what to work from. If you have a disability, they are amazing at providing what you need for work. But also, in terms of, in my situation, where I have needed specific hours, it has been difficult for me to get to the contact centre for various reasons. Caring for my elderly mother, I'm now the only sibling. Um, a lot of, well, the rest of our family all live overseas. So um, they have been so good, so accommodating at changing my schedule, my hours, and very understanding with that. Ensuring that I sort of get my annual leave for when my mother was coming out of hospital. They're very accommodating, and they're also open to new ideas. If you have, looking at the system, if you have any new ideas about the queue that we're working from, the calls, the way that we pull the calls off the queue, you have any new ideas about that, or anything that you want to bring to the company, they're very open, and I think that's a good thing. That's, change. It's always, if something's been done the same way for 10 years and hasn't worked, why are we still doing it that way, sort of thing. I'm not saying that at all about IC24, and I don't think that would ever happen, in this, company, because they, as I say, they're open to change. If thing works better, then why not? So that's quite refreshing. It's knowing that the company is sort of on your side about things like that, and very understanding, that it makes you less anxious and worried. It gives you peace of mind. So in terms of that, I mean, that's made my life better, me feel more appreciated and understood. Um, Also, in terms of, having a little bit more time, I don't work nights anymore. I have a routine, so I can plan future events much better. I can have more of of a personal life, and don't feel so tired. So I've got back to my swimming and running with the dog, and all of those things, yoga, and being, like I said, being able to plan on certain days. I want to go to a meditation group. I know what days I've got off, so it's easier for me to plan that, and to see my friends, of course. Yeah, so it's made a huge difference. Yeah. I think within the 5 months that I've worked for IC24, I feel like myself again.